Transforming Prison Systems to Prioritize Women's Mental Health, presented by Gianna Dagaramangian. Introducing the issue. Beyond the gates of prison, incarceration has a profound negative effect on people's lives, groups, and society as a whole. The intricate network of repercussions includes the interaction of gender and mental health, which becomes a critical issue, especially for women who are detained. It is critical that we bring attention to the often overlooked problem of women's mental health behind bars as we set out an important road of reforming prison systems. Every statistic conceals a tale of suffering, resiliency, and the pressing need for structural reform. Taking this into consideration, we find ourselves in a unique position to rethink prison systems in a way that puts the mental health of women behind bars first and create settings that support recovery, rehabilitation, and eventually justice. The percentage of women committed to prison has increased dramatically. It is common for women incarcerated to have experienced trauma and to struggle with their mental health in order to better comprehend women's experiences with prison-based mental health care. Let's talk about the statistics in women's mental health in prison. 3.9% are majorly depressed, 14.1% are alcohol and abuse addicts, 21% have post traumatic stress disorder, and 30% engage in self harm. Mental health problems are overrepresented and populated in the female prison population. Approximately 80% have a mental health diagnosis, according to the World Health Organization. Women in prison are 5 times more likely to experience mental health difficulties than women in the general population. According to the findings presented in the article titled Availability of Behavioral Health Treatment for Women in Prison, female inmates' access to behavioral health treatment during incarceration improves as compared to their community, at least in New Jersey. By attending to people's health requirements, their advancement supports this rehabilitative objectives of jail, which are to get out and get people ready for readmission into society, which is the entire goal of prison overall. To potentially avoid jail, this study emphasizes how crucial it is to provide community access to treatment, especially for substance-related problems. Given the importance of substance misuse treatment in the criminal justice system, this emphasizes the need for policymakers to address disparities in access to behavioral health care and to give priority to policies that target this area of mental health. A total of 10 out of 254 selected were considered eligible for inclusion, and the results showed that 6 major themes of mental health needs of women prisoners were treatment of substance, drug, and alcohol abuse, support system, empathy, and training, mental illness treatment, and access to healthcare services and health intervention, therapy, and counseling. It's time to understand the challenges. Understanding the challenges of the poor mental health system that we have in place in prisons for women today. The disproportionate prevalence of mental health disorders would be women in prison face a significantly higher likelihood of having mental health disorders compared to the general population, with a prevalence 5 times higher. This includes a wide range of psychological disorders such as depression, stress, aggressiveness, psychotic disorder, bipolar disorder, personality disorder, and drug dependency. 2. Limited access to health services and health care. Incarcerated women encounter specific health problems that men don't and experience restrictions in accessing adequate health services within prison facilities. Studies indicate high levels of psychiatric morbidity among female prisoners, with a substantial portion of their mental health needs going unmet due to poor performances of healthcare services and professionals within prisons. 3. Complexity of mental health needs. Research reveals that the mental health needs of women are multi-phase, encompassing issues such as substance abuse, trauma, self-harm, anxiety, mood disorders, and PTSD, as well as bodily challenges that men on the other side don't have, like hormonal deficiencies and disorders, menstrual cycles, all that sorts. These complexities require comprehensive and continuous assessment and treatment to ensure successful management, treatment, and reintegration. Again, which is the whole purpose of the prison system. And for gender responsive care and support, especially with like LGBTQ plus, the correctional system, primarily designed for men, inadequately addresses the unique mental health needs of women prisoners and prisoners of all genders, cisgenders or transgender, all the above. There's a crucial need for gender-based care, empathy, and support systems tailored to the experiences of individuals and women, including access to different treatments, skills training, mental health illnesses, and other health interventions such as therapy and counseling. Additionally, improving access to gender-specific mental health services within prison facilities is essential for addressing the mental health challenges faced by incarcerated women effectively. Accessibility to resources. So, women prisoners face a significant barrier in accessing mental health resources within prison settings, being so included and limited with it such a gender specific, specialized responsive service, and with long wait times and appropriate times for mental health professions. Um, there's a lack of gender specific mental health resources tailored to the unique needs of different genders and women prisoners, resulting in inadequate support and continuation of poor mental health decline. Institutional hurdles, different procedures and institutional rules often hinder women prisoners' access to mental health services resources, leading in delays and denials and not receiving the necessary treatment and care that they need to get better and to reintegrate back into society. It all goes back to almost like a domino effect if we don't tailor to their needs, and everybody is different. It's not a linear issue. So I think that is where the problem lies, that we're not treating these prisoners as human beings. We're treating them as criminals, which in essence they are. However, mental health is still important when we're talking about the lives of these individuals. And the allocation of mental health resources within prisons may prioritize male prisoners or general services, leaving women prisoners with insufficient access to essential mental health interventions, therapists, and help overall. All in all, importance in making a change, not only just for women, but in our society, is so important and crucial, especially for this topic. I can't emphasize enough how important it is to make a change and to build change in reforming our prison systems, because in reforming our prison systems, we need to start by helping who are putting in our prisons. It is so crucial. Um, we make it such a big emphasis on mental health overall when we forget sometimes the most who are struggling the most. So I think it's super important that we have more discussions about prison reform and the transformation into the mental health system, as well as who it's affecting the most. And these are my works cited pages. And that concludes my presentation on transforming the prison system to prioritize women's mental health. Thank you.